At 44, Jeffrey Caesar was in the prime of his life, but his weight was killing him.
It was one of those that, doctor says, you have to have this done or you're dead, and literally dead in 6 months.
He's an ideal candidate, really. I mean, he came in with, he's pushing 360, 370 pounds.
Dr. Stephen Burpee and Dr. Patrick Chason are specialists at Northwest Medical Center and are among only a few surgeons in the country performing the newest weight loss procedure. It's called the vertical sleeve gastrectomy, or VSG.
And we pass that tube along the esophagus, and it comes down just along the inside part here. And then we use that tube to gauge how much we're going to cut the stomach. And what we do ultimately is, after we've freed up the stomach all the way around to a point about 6 centimeters from the lower part of the stomach, we then use a stapling device and we actually cut the stomach using that tube as our guide, and then we remove all this part of the stomach. And the reason why this operation works is that when people eat, the food passes into this top part of the stomach, and they feel full from that, and they're unable to eat very much.
I can eat anything I want, but instead of having 5 pieces of pizza, I have a bite of a piece of a pizza, and I'm full.
VSG is just one of 3 surgical weight loss operations performed at the hospital that are done laparoscopically or are minimally invasive.
I was up and walking that day after surgery.
VSG, or the sleeve, works not only because a large part of the stomach is removed, it also affects food cravings.
By removing the outer part of the stomach, or the fundus, we remove the production of a hormone that's called ghrelin hormone. And by removing that hormone basically from someone, what happens is people lose their appetite. It's like a gift from God, and they'll lose their appetite for 6 to 9 to 12 months after the surgery.
It's been 7 months since the surgery, and Jeffrey's already lost 150 pounds.
You lose it so much and so fast. If you stay with the program, it's really kind of scary mentally. I mean, because you're looking at this person. Even today, I still walk by the mirror and I go, whoa. I have friends I've known all my life who walk right by me, who don't even know it's me.
High blood pressure, high cholesterol, acid reflux, I mean, you name it. I think he was on 9 or 10 different medicines.
Being so overweight had caused Jeffrey to develop other complications, including heart disease and diabetes.
Pam, I went from almost $3,000 a year, in medical, just prescription medicine and insulin, to I think I spent, well, this year I'll spend probably $100 on a medication I have to take, like a Plevex for my stents. Other than that, I am off everything. I haven't taken insulin in over 5 months.
2 other common weight loss surgeries, the gastric bypass, which involves moving a lot of parts around, and the lap band procedure, where a band is wrapped around the stomach. These operations are only for the obese, typically people who are at least 40 pounds overweight. The $15,000 sleeve procedure is still too new to be covered by insurance, but both doctors hope that will soon change because the results are so good. In the meantime, there's still no long-term data to know if patients regain the weight.
There's only going to be weight regain if they go back to their old habits. If they stay choosing the appropriate food choices, the appropriate diet, avoiding snacking and doing lots of exercise, the weight should not come back on.
Not only have Jeffrey's eating habits changed for the better, he exercises at least an hour a day. He's much happier and healthier now and has no intention of reverting back to the way he was.
But I have something in my car flap that I carry around that my daughter, my daughter wrote me, and it just basically says, "You look awesome, Dad. I love you." And that was about the 3rd week after my surgery, and the weight was really coming off.
The doctors agree there's nothing more rewarding than seeing their patients get their lives back on track after losing lots of weight. But surgery, they say, isn't the solution to what's become a serious and widespread problem.
The truth of the matter is we have a societal problem in the United States with respect to weight. And these issues are public health issues that need to be addressed in terms of nutrition, education in the schools, parenting education as far as how to feed their children, people being educated about how to eat normally in their lives, how to exercise and those types of things. And so while this is all very gratifying for us, in no way are we solving the problems of our society with this type of surgery, and I think it's important to keep that in mind.
For KUAT, I'm Pam White.